Thank you. And the governor thanks you as well. I know that applause wasn't for me.
Now more than ever, people need to be able to count on accessible health care. It could not be more fitting that today's announcement to help Massachusetts sustain critical health care services and protect the safety net by enhanced federal Medicaid support is right here at Cambridge Health Alliance.
Thank you, Dr. Osler. Thank you, Dennis, and to all of your team, all of the medical professionals and the members of the community who are here, the members of the board. Who, I take it when he says doubling your salary, he means from 0 to 2 times 0. I just want to be clear about that. I want to acknowledge all of the elected officials who are here and who are represented by those who are here, who are vital partners in helping us help you. And I particularly want to tell you how delighted Dr. Bigby, our Secretary of Health and Human Services, and her team and I are to be with you today. It is a very, very tough time. The world economy is in crisis, as you all know. Every individual, every family, every business in the Commonwealth has been affected. We're facing unprecedented challenges and in some ways a level of uncertainty that many of us have never seen, and some of us have never imagined. Now, times like these, I think, also remind us how interconnected we are, how weakness in one sector of the economy affect other sectors of the economy, how when one neighbor is struggling, a whole neighborhood is struggling. We rise and we fall together. In times like these, the mission of state government is clear: to secure our economic future, and that includes a strong safety net for our most vulnerable neighbors. That means you and the vital work that you and others throughout the system like you do. A lot of workers and clients in the health and human services fields are feeling this economic downturn especially sharply right now. I know that. I see you, I value you, and I know you are anxious. In other times of fiscal stress, services and eligibility for them were decimated. Tens of thousands of people were thrown off the Medicaid program. Coverage for essential dental, optical care, and prosthetics was eliminated. We have done everything that we can to avoid resorting to those types of decisions because we believe that in the end, they don't make us stronger. They make us weaker, in fact. Now, the truth is we can't avoid every tough decision in health and human services, and you know that too. But we are doing everything we can to minimize the impact on the populations who lean on you and on their government even more in times like these. We've had to make cuts, that's true. But thanks to the help of federal recovery funds, we have softened some of that blow, and we're able to avoid $1.2 billion in further cuts this year and next. Because we are set to receive an even larger federal Medicaid match than we anticipated, we are today announcing our plans to distribute some 574 million, let me be clear, additional dollars in Massachusetts and to Massachusetts HHS providers this year and next. First off, $255 million of these additional funds will help us secure jobs and support health care services for nursing homes, mental health providers, community health centers, and traditional safety net hospitals. This is very good news for both workers and patients. For CHA, let me be clear, because that's what you're listening for, that means $40 million next month and another $40 million. Secondly, we will continue and maintain our landmark healthcare reform initiatives by dedicating an additional $222 million in our fiscal year 2010 plan to maintain coverage and eligibility for all existing MassHealth and Commonwealth Care members, allowing for anticipated increases in caseloads with the creation of a caseload mitigation reserve fund. And third, we will dedicate an additional $97 million in FY10 to protect key safety net services at the Disabilities Commissions, the Departments of Mental Health, Public Health, Youth Services, Children and Families, and the Department of Developmental Disabilities, where we will restore funding for family supports. Go ahead. I want to thank the President of the United States and our congressional delegates. They helped bring this help for us to bear, and we are grateful to them and for their partnership. I want to acknowledge and thank the members of the legislature, including the leadership, who are also a part of these solutions. All of these funds will help, make no mistake about it. But remember, the federal funds are not a panacea. They do not address all our needs, and they will not last forever. Tough decisions and necessary reforms will continue to be the order of the day. So we need to continue to work together to find solutions to new and better ways to serve the public, and to do so efficiently, effectively, and with compassion. I look forward to being your partner in that. Thank you so much for having me.
It was never going to close down. There was going to be a change in the service delivery model, and I'm not clear what the management of the Cambridge Health Alliance has decided to do in terms of that. But it was always going to be open for service. That was one of those.
It's one of those rumors.
Well, I think people, having accessible health care it's an emotional issue for people. So I think that all people may have heard was Somerville Hospital is closing rather than maybe it's not going to provide this particular service at this particular location.
This is really an exciting day for us. We have been working with the governor, and we're really pleased to be able to have some hope and be able to talk to our constituents and let them know that there's help and hope on the way. So thank you, Governor, for your assistance. And to my fellow mayors, we really worked very hard to make sure that we could sort of keep the quality of care at the Cambridge Health Alliance as sturdy as it's been in the past.
It's the most successful safety net for the neediest of patients, and for our local quality of life, for our regional economy. This safety net, probably the best regional hospital system in the country, was on the verge of collapse. And the stimulus money here, as was applied by the governor and Secretary Bigby and their administration, is going to work. It's going to stabilize that system, allow it to grow in a new reconfiguration, and provide optimal care.